Well, it's a nonsense, and it's the kind of PR garbage, the window dressing that you expect. I was reading before we came on air there that NHS England is sort of infested with these management gurus who get paid up to like £400,000 a year. This is an NHS that's crumbling, where there's bed shortages, where we're seeing GP surgeries close. We're seeing the whole infrastructure of the NHS falling apart. I don't think it's the NHS's job to do this kind of, Jamie Oliver, big blue sky thinking nonsense.
You say that though, you mentioned big figures there. People with an unhealthy lifestyle cost the NHS £11 billion a year,
yes,
according to Public Health England.
Yes.
If they can spend a few quid on getting people free cinema tickets or sports gear or whatever to encourage them to do walking and get healthier and get fitter, could it not save the NHS money?
No, because the biggest contributor to health inequality, and we've actually seen a widening of the gap of life expectancy between the richest and poorest in the UK. So in the sixth biggest economy in the world, we're actually seeing the life expectancy between poor and rich widening over the tenure of this Tory government. Poverty is the biggest cause of health problems, and we have a government who has closed council playing pitches to build property on, who has cut school budgets, which means we see PE cut back on, so pupils spend less time. These are the kind of legislative things that we can do to help poverty. Why are we not talking about giving these people a living wage instead of, it seems to me it's like policing the bodies of the supposedly feckless poor. We'll give you a voucher if you do so many steps a day. It's obscene. Let's deal with the real issue. There's a profound issue in the way people's lives are structured, the shift work they do, 0-hour contracts. We've seen the mental health kind of epidemic that's spreading because of the lives that people are leading, and it's not cinema vouchers that are going to cure that. It's much bigger action.
Scheme that's being done by NHS England. And you go through some of the things that they're doing here. They're specifically talking about free bikes. They're talking about sprinting tracks potentially being built. Those are all actually things which you presumably would encourage, because you're talking about losing playing fields. This is actually about building things where people could exercise.
Well, it's not building playing fields. It said building a sprinting track. I mean, what I would argue is that if you want a healthy town, then stop privatising and subcontracting the duties of a council, local democratically elected council. So we saw the tragedy, the murder, I would call it, in Grenfell Tower, not about actually dealing with social inequality. So stop privatising leisure centres, so as we get private gyms with very, very costly, membership fees. Let's keep those leisure centres open. Let's keep playing fields open and stop building on them so as people have somewhere to go. It is typical of the distraction politics of individualising. It's down to you as the individual. You're the reason of all this. Instead of actually looking at the societal changes that we need to look after people's health.
You were quite dismissive there earlier on whenever you referred to Jamie Oliver, saying, doing a Jamie Oliver here. Actually, if you look at what Jamie Oliver did, and I've been to some of the towns in the north of England where he kind of did a lot of that work, and you look at the impact that has had.
Well, absolutely, and perhaps I am too dismissive of Jamie, but the Labour government went into this election arguing that there should be free school meals for all children. The Tories came up with a last-minute offer of 7p breakfasts for school children, which is ridiculous. These are the kind of initiatives, simple legislation that look after the health of citizens. It starts early and sets a trend. But this idea of vouchers, as a solution to the society where we're seeing people's ability to engage in sport. I mean, look at the Olympics. It only took 1 year after the Olympics for government cuts to hit school PE time, where we had leading experts saying there's no legacy of the Olympics. School children are doing less sport. All the Olympic funding went to was public school guys to do their rowing or whatever it was. Can I just come back on that?
Of course you can, Phil.
The idea of the individual, because it seems there's like a cultural trend now to reawaken that idea of the feckless working class. The simple solution is this: do not cut education funding so as kids get the best start in life, who get a school meal and exercise in school. Limit the corporations and the kind of food they can manufacture and the kind of stuff that they can sell. One of the things about Brexit is we're moving away from regulated food so as we can get, chlorine chicken sent in.
But Barry has just texted the programme and said, I'm not against the NHS giving tickets, but I'd like to see an NHS levy on junk food.
Yeah, well, very possibly. But also, let's look at the NHS. It's going to spend money on this scheme, which seems to me, wafer-thin nonsense. They've cut nurses' bursaries, so the number
not intended.
the numbers applying to be nurses has shrunk dramatically. We've seen the crisis in GPs. Let's look at the substantial risk to the very future of the NHS instead of handing out step counters so as people can get a cinema ticket. As you said earlier, cinemas are not going to be heavily populated with postmen.